cancer is really like a tree. You're not going to kill it by cutting off one of its branches. You have to really hit it from a multitude of different ways. And so, if we think about diet as being one of the branches, yes, it's super important. It's one of the pillars. But we also have to use other methods to really make sure that we're controlling it.
Could a ketogenic diet help treat cancer? Well, we're learning a lot about this, and the answer is probably yes. Now, what types of cancer and what do we mean by treat, right? Treating the tumor and treating the patient, which is really important. And today I'm joined by LJ Amaral to discuss these different aspects. Now, LJ is a registered dietitian and she's certified in nutrition oncology, and she's a researcher at Cedars-Sinai. And she was the author on a recent publication looking at ketogenic diets for treating glioblastoma, or very serious and progressive brain cancer. And one of the things I really like about LJ's message is that, yes, we're treating the cancer, but we're also treating the patient. We're treating the individual. And that's a really important concept to think about when you talk about treatment success. Now, what cancers might ketosis be good for? How does it work? What are some of the concerns? Where are we in the level of evidence? It's early, but LJ really helps explain a lot about the concepts and what the future might bring. Now, for LJ's study, it was keto in addition to standard of care. And again, none of this is medical advice. All of this should be discussed with your healthcare team. But it's starting to look like ketosis and nutritional interventions certainly could have a role in cancer therapy. So I hope you enjoy this interview with LJ Amaral, where we discuss this further. Hi, LJ. Thanks so much for joining me at Metabolic Mind.
Thanks for having me. I'm excited to be here.
Yeah, and I'm excited to talk to you about your paper about using a ketogenic diet as an adjunctive treatment for glioblastoma type of brain cancer, and sort of about keto and cancer in general. And in a way, it's a little strange, right? We're Metabolic Mind. We talk about metabolic and ketogenic therapies for mental health, for brain-based conditions. Well, I mean, glioblastoma certainly is a brain-based condition, but we're also, sort of branching out to talk a little bit more about other avenues of ketogenic therapy for metabolic health, for other conditions like cancer. So this will be really sort of our first discussion about that. And, when people say, well, how does ketosis work, quote unquote, work for treating mental illness, you could sort of boil it down and say, okay, well, the primary focus is probably more efficient energy production. But then there are other things, right? Neuroinflammation and GABA and glutamate and just the ketones themselves and improved metabolic health, right? There's this constellation of things. So if I were going to ask you the same thing, how does keto work for cancer, right? A very broad question. How would you
Yeah,
answer that?
the exact same way.
Yeah.
Yeah, it's extremely nuanced, and of course, there are multiple factors that are playing into the efficacy of the diet and how it works in terms of, augmenting or working in synergy with um, standard of care treatment. But really, it's a number of different ways that it's working. The metabolic effects, in terms of reducing glucose and overall energy, having a more efficient use of energy, perhaps even sparing muscle protein. I think a lot of people are looking at that for cancer and cachexia. And then the inflammatory part of it, we've done some case series where people have actually improved their fatigue while on chemotherapy and radiotherapy for their cancer. So I think it's pleiotropic as well for the cancer field.
Yeah, and in your answer, got me thinking it also really depends on how we define work, right? I said that very generally on purpose, right? You can't say it works for cancer or it works, right? There are certain stages, certain circumstances where it will have different effects. So you talked about one of them, like with treating cancer, it's not just about making the tumor go away. It's how is the person doing? How is the person responding to their treatment? So that was interesting that you talked about maintaining muscle, not having cachexia, quality of life. So do you see that sort of differently than treating the tumor, or is it kind of all the same?
I like to think of it as all the same because from my perspective, especially coming from a nutritional standpoint and looking at the person as a whole, I think it's really important to treat the patient as a whole. And so making sure that they are getting not only the benefit from perhaps reducing their cancer, but, also the benefit of maybe they have better mental health or less anxiety or they're sleeping better. They're able to exercise more, keeping up with those ADLs or activities of daily living, I think are just as important as reducing the tumor.
Yeah, and that's a really good point. And And when we talk about keto for cancer, we've got to be honest, right? It's sort of early stages of research, early stages of clinical experience. But something nobody was talking about, I don't know, 20 years ago or whatever, even a decade ago, hardly anybody was talking about, right?
Right, yeah.
Yeah. So it's
I mean,
made,
I started this a decade ago, and I was kind of like a pariah, I suppose, because I'm a dietitian and I'm telling people to eat high fat, and so, a lot of people were not, interested in hearing what I had to say, especially because there aren't a lot of studies or there isn't a lot of clinical research out there that's backing the use of this diet, especially within the context of cancer, but, I think, if you wanna make change, you have to do something different.
right, right. And so it seems like Dr. Thomas Seyfried has been doing this probably the longest as anybody I know. And even then, though, not so long in terms of the history of cancer therapy. So this other thing that's really interesting though is about, tumors and how they use glucose, but really sort of can't use ketones. And it depends maybe on the tumor and the specifics, but that's like a very broad way of saying it. But this general concept of like the Warburg effect, can you describe that sort of
For sure.
mechanism a little bit?
Yeah, absolutely. So the Warburg effect is a really well-known theorem that was created by Otto Warburg in the 1920s. He's a Nobel laureate, and basically, in his research, he found that cancer cells versus normal cells use an abnormal amount of glucose and produce a very inefficient amount of energy when compared to normal cells. So normal cells are able to produce a large amount of energy with a very small amount of glucose, and cancer cells basically do the opposite. They use a large amount of glucose to get a very little amount of energy or ATP. So it becomes this like fixation. A lot of people like to say that there's like this increased affinity for glucose as the primary fuel source for tumors. I don't think that we have a lot of evidence out to say that specific tumors can use ketones as an alternative energy source. But I think that's also something that needs to be elucidated because I think there are some studies that, in certain types of cancer, fat may not be appropriate or a high fat diet may not be appropriate.
Right, and that's, it certainly complicates the discussion. We can't talk about cancer as if it's one thing. Breast
Exactly.
cancer is different from melanoma, is different from pancreatic cancer, is different from lung cancer, is different from brain cancer. So let's focus specifically on glioblastoma. So maybe define what glioblastoma is, and then we can talk specifically about keto and the effect of glioblastoma.
Sure. Yeah. So glioblastoma is a stage four brain tumor. It's a very unique and it's considered a rare brain tumor, even though I think John McCain brought a lot of light to it because he unfortunately passed from it. Bo Biden, a lot of people from his army platoon or troop ended up getting glioblastoma. So, yeah, it's a nasty tumor. Unfortunately, there aren't a lot of treatments for it, and the prognosis is pretty poor. So it's one of those things where um, I think a lot of people become very discouraged when they get this diagnosis because there really isn't a lot of hope out there in terms of treatment and quality of life once you get diagnosed.
Yeah, so standard treatment is chemotherapy, radiation, and often
Surgery if possible.
yeah,
Yeah.
yeah. And the treatment and the resolution of the tumor is difficult and poor, and so is quality of life though. I mean, a brain-based tumor can really impact quality of life in a lot of different ways. So like you said, it's sort of the both. It's the survival, but it's the quality of life while you're surviving as well. And they're both kind of not so good with glioblastoma, huh?
For the most part, in my experience, a lot of people haven't been so lucky in terms of, getting their diagnosis and having pretty debilitating symptoms and having to continually manage them. I have a running joke with some of my patients that they describe it as a whack-a-mole situation where it's like you're kind of like always battling something that's popping up. And yeah, it can create a lot of the stress. And so I think if there's anything that can not only help their tumors, but also help them feel better or help them get through treatment better while they're still maintaining some sort of normalcy is imperative, especially if they have, a limited time left.
Right, right. Now, there's been research and case reports on keto for different types of cancers, But it seems like the most common tends to be, or at least the most common that we read about in the literature, seems to be glioblastoma. So
Yep.
is there something specific about glioblastoma that makes it maybe more amenable to a ketogenic intervention?
Yeah, I think glioblastoma is a very interesting type of cancer to use as kind of like the poster child, I guess, for using keto as an adjunct to their treatment. I think a lot of patients, even though keto has been used for refractory epilepsy in pediatrics for the same amount of time that Otto Warburg has been around using the Warburg theory, um, people do have a lot of seizures from their tumors with glioblastoma, whereas, of course, epilepsy is a different mechanism with the neurotransmitters. So there are differences in the neurotransmitters as well for patients who have glioblastoma versus normal patients. So I think that there was kind of the idea that, hey, maybe we can also help them control their seizures with this diet. And then, yeah, you see the different effects later on. Oh, the patient is feeling better, or maybe I remember there was one case study that I looked at when I first started this 10 years ago of an Italian woman in her 60s who went on an all water fast, the glioblastoma. And that basically also started the idea of, hey, maybe we can use this in the critical setting. I know Dr. Safri has been around since the 90s doing this in the basic science or, the in vivo, in vitro setting. So I think that there's been the most preclinical evidence and then the most anecdotal evidence for this tumor situation. And it's been very interesting to see the evolution of it, in terms of not being used at all or having these really scarce case series to now, we have like a randomized multi-center phase 2 clinical trial that's funded by the American government.
Yeah, so tell us a little bit about this, the design and the main findings of your trial.
So we had in total about 17 patients who completed our phase 1 trial. So it was a single center study looking at brand new diagnosed glioblastoma patients, adults only. They had to be within 3 months of their initial diagnosis. And then they went on a 16-week supervised ketogenic diet, a classical ketogenic diet. And then we collected a bunch of different metrics on these patients. And we looked at quality of life. We looked at Fitbit because we had them wear a Fitbit. I looked at their ketone and glucose numbers because we use Keto Mojo. So we had that the ability to actually check if they were adherent to the diet through their ketones. And also, of course, like double checking with their medications. A lot of them, I think about half of them were on steroids, and we do note that in the paper as well. So that affects, people's ability to stay and maintain ketosis, and they were unfortunately considered medically necessary for those patients.
Yeah, I was really curious about that because one of the things that's talked a lot about for ketogenic therapy for cancer is the GKI, or the glucose to ketone index, which when you're on steroids, that kind of goes out the window because glucose is going to go haywire. So tell us about the GKI, about its theory in cancer, and about how maybe it wasn't so impactful in your study.
Yeah, we had a difficult time. I think it's also difficult because there isn't a necessary or there isn't a defined threshold for ketosis or GKI within the oncology population. I know in general we want to between like a 2 and 3, the GKI for cancer patients. I think Seyfried is he's published that. But because we have the steroids and, these people are going through chemotherapy or radiation, or they had surgery, they have massive brain swelling, really debilitating symptoms. They may have had seizures, continue to swiping on the diet, physical issues, so there were some things that we just couldn't get around, unfortunately, and we really needed to use them for them to start feeling better.
Yeah, so I guess I should rewind for a second. So GKI, glucose to ketone index, so basically just
Yeah.
the glucose divided by the ketones in millimoles. So they're both in millimoles. And then the thing about the steroids, with a brain tumor, there's a lot of swelling around it and edema and swelling in the brain. There's not a lot of room for it to go. It can cause a lot of problems. So the steroids can help reduce that more so than, breast cancer and colon cancer and lung cancer. You don't see the same use of steroids as you do in brain cancer. So that's the difference there. But so let's get into some of the results though. I mean, the first result, like you said, it was a small study, but a feasibility study, and everybody was in ketosis more than 50% of the time. So check that
Exactly.
box, right? Like a lot
Yep.
of people would say, they're going through chemotherapy and radiation. They're not going to feel well. They're not going to be able to stick to a diet. They're not going to be able to do it. But no, you didn't see that. You saw the opposite, huh?
Yeah, I mean, listen, I was the main, dietitian for the study. I worked with every single patient who went through. Um, I I was very encouraging. That's also, like, my nature. I'm a very positive person. I like to find the silver linings, and, I've worked in cancer for 11 years, and I find that not for everyone, but for a lot of people, they really appreciate that hope and that positivity, and so, I think for a lot of these patients, it was really, just amazing to see that they could have, ketosis for more than 50% of the days, getting a lot of encouragement, but also the benefit from that too. So we saw, a really big increase in overall survival and progression-free survival, even though we weren't powered for that, but also we saw increases in physical activity, feelings of well-being. We didn't have a lot of adverse events, which a lot of people think, hey, they're on chemo radiation and an extreme diet. They're not going to feel good. They're not going to want to eat. They have GI distress. Yes, that is the reality of the situation for some people, but we can also mitigate that. There are ways to make it work and have them still maintain their ketosis. Or, maybe we work with them and say, okay, if you're really not feeling good, maybe we use X, like, Zofran or ginger tea, or on this one day we put up a little bit more of your carbs, and then the next day we'll push more of your fat. So it was a lot of personalized titrating. But I think the important message from this study is really you can do this. Patients can do this. They want to do this. And I think it's imperative from a healthcare professional standpoint that we are supporting these patients and not having them, be out on their own on an island doing this without any supervision or support.
Yeah, that's crucial about the support aspect of it. Now, and you listed a number of the findings. Now, without a control group, it's hard to have a comparison. But like you said, you've been doing this. You know, sort of how your gut tells you how the average person responds. And so, like, does the average person feel worse and have low energy? And like, would you say it's kind of the opposite for the average standard of care treatment?
From what I saw, yeah, I think that there were massive improvements with our keto patients versus their, control or historical counterpoints, or counterparts. So yeah, I do think that they did have a benefit. Um, and there's kind of this caveat where what I've seen is very similar to immunotherapy, where there are some responders and quote unquote non-responders. So I had a handful of patients, not a lot, but certainly, a small subset of patients who had a really difficult time not only entering and maintaining ketosis, but just not feeling well on the diet. And then having that like exact 180 where we had patients with amazing ketones, really low glucose, fantastic physical activity, sleep, overall feelings of well-being only on the diet. And, after the 16 weeks, patients had the option of either continuing on or, doing their own thing. And, a lot of patients ended up continuing on the diet. And the few patients who wanted to do their own thing ended up telling me, I actually didn't enjoy eating this way anymore, or it didn't make me feel good. Or I had one patient, she went to Pinkberry like 2 days after she went after off the study, and she had a seizure. So I think for some people, it can be very telling, whether you have a response or not when you, kind of experiment and do some trial and error and see, as I get off, how do I feel? And
Yeah, and looking at some of the other results, you listed the progression-free survival at 12.9 months and the overall survival at 29 months, which again, with no comparator. But then in the paper, you also listed that a comparison study showed progression-free survival of 6.9 months and overall survival of 14 months. So you can't do the direct comparison, obviously, because different patient population and so forth. But gosh, just that alone should like raise everybody's ears a little bit and say maybe this is something we should look into more. And of course, Dr. Seyfried had published a study recently looking at 18 patients, looking at those who adhered to the diet and those who did not adhere to the diet. And there was a drastic difference in 36-month survival, 66% for those who adhered, 8% for those who didn't adhere. Now, that could be self-selection, but I mean, you put these two together for a patient population that, like you said, the treatments aren't great, and everybody should want to be studying this. So you mentioned there you have a stage 2 trial. So tell us about your upcoming trial.
Yeah, so you keep mentioning a control group, which is amazing. So we just got an R01 from the NIH last year, or I guess maybe it was 2 years ago now. So we're looking at a phase two. So we're actually looking at efficacy this time. Phase one was the feasibility, and then this one is looking at efficacy. So we're open at Cedars-Sinai, St. John's, Providence St. John's in Santa Monica. We're open at UCSF in San Francisco. We're open at Duke, and we are about to open at Wisconsin, I believe. So it's looking at the ketogenic diet, the same one that we did in the phase one, but our window of time now is much smaller. So you have to be brand new diagnosed. You cannot have started chemotherapy or radiation in order to qualify for the study. So we're trying to get patients before they start their chemotherapy and radiation to really tease out is this diet related and is it really synergizing with their treatment or not? So I think we have like about a week buffer for patients. So if they started their chemotherapy and radiation, which is 6 weeks long, if they've only done the first week, then they can qualify for the trial. So we're looking at the ketogenic diet 3-to-1 versus an American Cancer Society diet. So it's considered like a high fiber diet, which is kind of the opposite. High fiber is considered high carbs, but it's the most or the most studied, and it's the most well accepted, I think, for most solid tumors. And that's another caveat of brain tumors. We don't have a lot of nutrition related studies because it's considered like a rare tumor versus, let's say, breast cancer, which is the most common cancer amongst women. That's heavily studied, especially within the context of nutrition. So just another caveat, but really the study is powered to look at whether or not the ketogenic diet is actually showing a difference in overall and progression-free survival between patients, not only within our center, but across the country.
Yeah, I think that's so great. LA, San Francisco, North Carolina, and Wisconsin. So four different geographic areas where people can participate in this study. That's fantastic. Fellow mental health clinicians and healthcare providers, you now have access to a suite of free CME lectures on metabolic psychiatry and metabolic health. Each of these CME sessions provide insight on incorporating metabolic therapies for mental illnesses into your practice. These CME sessions are approved for AMA Category 1 credits, CNE nursing credit hours, and continuing education credit for psychologists. And they're completely free of charge on mycme.com. Now back to the video. But now, I want to put this in perspective a little bit. I remember talking to some oncology friends, friends of mine who are oncologists, and talking to them about this, and they're like, yeah, I mean, we usually just say, eat whatever you can. We just do whatever you can to not lose weight. If that means going to, Dairy Queen to get your slushy or whatever, the ice cream and everything, just whatever you can eat. And here, you're putting people on a quote unquote weight loss diet, right? Keto's thought of a weight loss diet. So how do your nutrition colleagues, dietitian colleagues, how do they respond to this when they hear about it?
Yeah, it's been interesting. I think in the beginning it was really, I felt like a salmon swimming upstream. Like it was really difficult. I found like people thought like I was nuts, which like I understand. Like it's not something that has been done before or even and been considered. And frankly, I can't even take credit for this. All of this was started because I had one 40-year-old patient who said I want to do keto, and he had a glioblastoma, and it was my first job, and I was like, well, I'm not going to let you do this alone. And he really started this whole process. So, shout out to Dave Shevak. He's amazing. And has changed so much for so many different people. So, I do love that. But, yeah,
Yeah.
I went off on a tangent.
No, that's okay. That's okay. But it's also this concept that, we need to realize this is not a weight loss diet. If you have a lot of weight to lose, it's an effective weight loss diet. But if you don't, it's actually not a weight loss diet. And it's a medical intervention that changes your metabolism, changes your fuel utilization. But if that's what people need to realize, if you don't have weight to lose, you're not going to lose it. And there's, with the protein and fat that you're eating, it's actually probably a good thing in a situation where you otherwise would be losing weight, because people tend to eat the carbs, the comfort foods, the easy foods, and probably don't eat as much of protein and fat, which is probably what they need when they're experiencing cachexia and weight loss. So, I mean, it's so interesting when the quote unquote truth, if you don't call it truth, is the exact opposite of the perception. So, I mean, do you think it's going to be a while before nutrition as a whole catches on to this concept?
I don't know. I mean, I think, you have a really good point. I have had patients though where they were lean to begin with, and then we put them on the diet and they have lost weight, weight that they didn't have to lose. And, that can be difficult. But then we also have to think about the other side of the picture where we're getting patients who may have been extremely active before they got diagnosed. And then now, they've had surgery, they're recovering, they're not allowed to pick up more than 5 pounds. They have swelling, edema, and they're not working out or being active now for 6 weeks. You're losing a ton of muscle. So if I'm putting you on the diet, it may not just be that the diet is making you lose weight, but there's also other processes that are happening that, are making you lose weight at the same time. But I think that's also why you have to work with someone while you're on, cancer directed therapy if you're going to do, like a really hardcore ketogenic diet. And I'm not saying like you're doing like a one-to-one, like you're matching your protein and your fat to your carbs. I'm talking like you're really, really, really prioritizing fat. You're having fat bombs. You're putting MCT oil or olive oil on certain things. You're really working on getting that ratio up. Um, but there are ways to make it so that you're not just eating gobs of butter. You can make it so that you're still getting nutrients, like you're still getting the dark leafy greens or the healthy fats or the good proteins or nuts. We can make it so that you're not just swapping a processed food for another processed food just because the macronutrients are different. That's not the type of ketogenic diets that I would subscribe to. And it's not something that I think, that would confer a benefit. So I think it is really important that it's really augmented to the patient so that it's giving them a health benefit and not making their health worse.
Yeah, very good point, and that's why it's so important to work with an expert like yourself. Not everybody's going to have access to you, of course, but there are lots of coaches and dietitians, even if they're not familiar with the cancer space, can help with the ketosis space, and then hopefully coordinate with the cancer team to get a coordinated treatment. But also in your study, the diet was added to standard of care. So by no means is there a recommendation, forget the chemo, forget the radiation, the diet's going to take care of everything.
No.
No, no,
Right.
definitely not.
Yeah,
Right.
we wanna hit it, and I love using this analogy. I mean, I think most chronic diseases are this way, but, I can only speak to cancer because that's what I feel the most comfortable in. Cancer is really like a tree. You're not going to kill it by cutting off one of its branches. You have to really hit it from a multitude of different ways, and so if we think about diet as being one of the branches, yes, it's super important. It's one of the pillars, but we also have to use other methods to really make sure that we're controlling it and also like we said in the beginning of our talk, that we're also, treating the body and trying to minimize and mitigate the amount of damage that, conventional chemotherapy or radiation or cancer treatment can create.
Yeah. Yeah. And, and I think that's really one of the biggest take homes. People say chemotherapy is poison. Well, yeah, it is. It's poison for the
Yeah.
cancer. It's poison for the cancer, but, and can, yeah, but can also be poison for the rest of your body. So you want to find whatever you can do to minimize the effects on your body, maximize the effects on the tumor. And if a ketogenic intervention can be part of that, then by all means, it should be studied and could be considered. Which leads to another question about fasting. So not just ketosis, or a ketogenic diet, but fasting, which can also induce ketosis. There's been a lot of talk about using that maybe strategically around the time of chemo or around the time of radiation. Is that something that you're familiar with?
Yeah, I think, there are a lot of different studies that are looking at timed fasting, like you're saying. So there are some protocols where they have, the fasting happen the day before, the day of chemo, and then the days after. Cedars also has a study looking at fasting mimicking diet for prostate cancer. The bottom line is really we don't have protocols set up yet for these patients to follow, and I think that is really important. We don't know exactly how effective it is, especially within the context of brain tumors, you fast for, let's say, 18 hours or 20 hours, or you're fasting 2 hours before and after. I don't know how that affects the typical patient, but I do know that a lot of patients do like using it as an adjunct to their ketogenic diets, and I'm all for supporting patients on whatever individualized journey that they want to go on, as long as they know, try to stay hydrated during that time. Look out for the signs and symptoms of hypoglycemia, know how to treat them. And then we have to, obviously make sure that we're watching weight and what they're eating within the smaller window of time that they're eating, and making sure that they're meeting, their needs to avoid any um, detrimental weight loss or muscle loss, especially.
Well, I can't thank you enough for taking the time to join me today, and congratulations on your publication and starting the next phase of the study, which I think is great. I mean, it's clear we're just sort of at the starting point here, and I think there's going to be so much information coming, and anything that can give people hope for a better quality of life and better survival. Like we need to double down, and we need to learn more about it and research it. So thank you for doing that work. If people wanted to learn more about you and the work you're doing, is there someplace they can go to learn more?
Yeah, I used to be online. I've recently kind of cut that out of my life. I'm on ResearchGate. I'm on LinkedIn. You can email me. I'm kind of old school, but yeah, I mean, I think it's imperative that we find things for patients to do that not only give them hope, but also advocacy, and give them control of their own outcomes, and give them something that they can do to provide their own hope and positivity when they need it.
Yeah, great, great. Well, thank you so much.
Thank you.
Thank you for watching. If you want to see more, check out these recommended videos. Also, if you haven't already, don't forget to subscribe to our channel to stay up to date with our content and help us expand the movement. And if you want to sign up for our newsletter, access our resources, read the latest research, or check out the Think Smart framework, click here to visit our website. See you on the next video.